Welcome to today's weekly Zoom conference. I'm Sandy Close, Director of Ethnic Media Services. Today, our topic is the nationwide surge in new COVID infections. What to expect, what should be done, what role a vaccine will play, how soon to expect it. Now, I turn with pleasure the conference over to Sunita Sarabji.
Hello, everyone. It is my great pleasure to introduce Dr. Wen, who will moderate the conversation with Dr. Shah and Jha. Welcome back to both of you.
Thank you, Sandra, and thank you, Sunita. The daily rates of new infections are at 120 to 150,000 cases, about a 60% increase from the last 2-week trends. About 1,000 Americans die from COVID every day now. We're clearly in the third wave of the pandemic. The numbers are actually much higher than the first 2 waves. It's happening at a very bad time. Flu season has not even started yet, and we're already getting reports that hospitals are being overwhelmed. In addition to concern about bed shortages, healthcare workers are dying and burning out. They've been doing this for close to 7 or 8 months now, and we may get into a situation where we may have beds, we may not have enough people to staff it. So these has implications that's beyond those unfortunate enough to get COVID. Anyone with any medical condition that needs hospital care in the next few months are going to be impacted. So I want to start by asking Dr. Jha and Dr. Shah a question about the current state of the pandemic and what's going to happen in the near future. What do you think will happen in the next 2 months? And what can we do to change the course? And we can start with Dr. Shah and then go to Dr. Jha.
Thank you for the introduction and the opportunity. Unfortunately, as you can see, the numbers in the United States are at an all-time high and trending in a wrong direction. And we know exactly why that's happening as well. This is not a surprise. We predicted this, that with the fall, with people staying indoors, and without the kind of broad protections we know we need to take, such as masking, such as not gathering in large groups, the numbers will continue to rise. So this is not necessarily a surprise, unfortunately. And at the same time, we also know what we need to do to get the numbers under control. So we do need to not wait until the new administration, but start making changes now. You may have seen that New York City has canceled public schools again. And so we are going backwards. We're not going forwards at this time as a nation.
Thank you, Dr. Shah. Dr. Jha?
Thank you. Liz, let me just build on what Nirav said. We are in the worst moment in the pandemic right now. We have more infections in the United States than at any point. And that's not just based on the case numbers. We have a lot more testing, so we do have a lot more cases, but it's just we have a lot more infections now than we've had at any point. Right now, we have about 100, as you said, about 120 to 150,000 cases being identified every day. But the truth is that the true number of infections that are occurring in the United States right now is between 300,000 and 400,000 a day, maybe even closer to 500,000. We're just missing 2/3 to 3/4 of all of the infections. We're missing them because our testing is inadequate. And so because of that, all the people who are not being identified are, of course, out there spreading the virus to others. And we're in the moment of exponential growth. And so by all expectations, we have 1,000 deaths a day right now. We will get to 2,000 deaths a day by mid-December. And my estimations are that we're going to have an additional 100,000 Americans die of this disease between now and the day that Joe Biden is inaugurated president. That's what we're on track for. And I don't think during the entire 9 months of the pandemic, I've been on the front lines. I've been very deeply engaged. I don't think I've ever felt a moment where there's a bigger disconnect between how bad things are and how little attention we as a country are paying. That contrast right now is baffling to me. I don't understand it. I don't understand why. And here's the one last part, which is, and I know you may want to get into talking about vaccines. We are so close to getting to a point where the pandemic starts getting under control. And so to me, it's particularly unconscionable to lose another 100,000 Americans over the next month and a half, 2 months, or let's say next 2 months, when we know that we are going to end up in the spring with, I think, highly effective vaccines that will make a very big difference. And so it just feels like we're giving up right at the last minute when so much suffering is on the line, and we can largely prevent it by many of the things that Nirav talked about.
I just want to follow up quickly on that. Now, we are in this state, and why are we in this state? I mean, I think beyond what we each individually can do, why are we here?
We're here for three reasons. One is we've had a federal government that 2 months ago made a strategic decision to stop engaging and helping with the pandemic. When Dr. Scott Atlas really took over the coronavirus task force, his strategy has been, he's been very explicit about it, that he believes America is better off if we just let the infection run. And I think it's unconscionable, and I think it is not based on science, but he believes that. So what that has meant is that the White House's footing, which has always had been, we should control the pandemic. We can criticize whether the White House was doing a good enough job or not, but at least publicly, they were saying they were trying to control the pandemic. Now their footing has changed to we're no longer trying to control the pandemic. And we heard that from Mr. Meadows, the chief of staff. So that's been one, but the White House has let go. Second is that there has been no aid from Congress to states and to individuals. And so states are in really bad financial shape, and individuals are, and states are making, I believe, a series of bad choices. Indoor dining is still open in New York. In Boston, the Boston public schools are closed, but casinos are open in the greater Boston area. First of all, I think from a societal point of view, closed schools but open casinos are the wrong trade-offs. But from a financial health of the state point of view, casinos bring in revenue, schools do not. So what we need, we've also had an abdication by Congress that has chosen not to provide any support to states over the last 4 months. And that has been, and then the third is, I think, just individual fatigue. People are tired of this. They've been going on this for a long time, and they're not seeing much action out of their political leaders, and they're letting their guard down. And you put all of that together, and you are where we are right now.
Dr. Shah, any additional thought on why we're here?
Yeah, I think Ashish did a really nice job summarizing the multi-levels of failures of leadership that we've seen. I'll give you specific examples. You know, we know some CARES Act funding has gone out to the states, and several states have not even spent it. They've been claims of hoarding that money for who knows what, as opposed to using it for public health. So there's lack of leadership on many levels has led to where we are. And what we need is that strong, unified voice, one plan that we all agree to that leads to control, like other countries have done.
So I'll follow up on the question about leadership. So what should Joe Biden and his team do on day one?
So there's a lot that the Biden administration can do, the Biden transition team can do between now and January 20th. So obviously they don't have any formal powers. I often say, you know, that Mr. Biden has no more power right now than he did a month ago or a year ago. He's a private citizen. But he's not. He's president-elect, and his team is got a lot of soft power, and soft power is what we need right now. So I think Mr. Biden should certainly be very actively engaged himself in talking to people about wearing masks. I have recommended that he consider doing a road trip to red states where there's a lot of skepticism about mask wearing, and talk to people openly and honestly about why wearing masks is a good thing to do for yourself, for your family, for your community. Will it convince everybody? Of course not, but we don't have to. Any movement on that, I think, would help. From the transition team and the COVID task force, one of the major problems we have is we have wholly inadequate testing. One of the reasons we have wholly inadequate testing is that there hasn't been a clear market signal to providers of testing. So I have probably spoken to every major manufacturer of testing in America over the last couple of months. They can ramp up testing a lot more, but they don't know that anyone is going to be on the other side to actually buy the tests, and they can't afford to make the investments. The Biden team can start saying to people, we're going to be in office in 2 months. We promise you we'll buy the tests. And that is a credibility that will have a huge market signal to these companies. And I can imagine a large ramping up of testing that they can do. And then the last thing is, I believe they need to be talking to members of Congress, to both Democrats and Republicans, to get a stimulus bill out that gives money to states for testing and for other things, so states can start playing a more active role. If those are three things they can do right now before they show up to power on January 20th.
Yeah, I agree with all those. I'd add one more. I think the lack of trust in science is at an all-time low, and our solutions will be successful if people trust in science, if people trust in a vaccine when it's available, if people actually take both doses of the vaccine when it's available, if they're offered. Those are things that we need to work on now to rebuild the trust. When we talk about masks, it's not a political issue, it's a science issue. And starting to understand how science drives decision-making and understanding and connecting the dots for the general public, as well as our leaders, saying this is what the evidence shows, this is where we have equipoise or we're not sure. And based on what we know, we believe the following: avoid large gatherings, practice physical distancing, wear masks, stay home when ill, and self-quarantine after exposure. Those are simple things, and it's our job collectively as the media and as leaders to repeat those messages every chance we get. The CDC report today showed 2 reports of super spreader events, one in rural Maine at a wedding reception and another in the Amish community. And it's because those simple things that we know to reduce transmission weren't performed. When you have 55 people at a wedding reception, when the state limit is 50, you're doing something wrong. When you're not wearing a mask and you feel ill and you're going to work in a long-term care home, it's no surprise there was a secondary outbreak in a long-term care facility. These are things that we knew back in March, April, what we should be doing, and yet we're not doing it because we do not have that trust.
Thank you. I want to turn over to the vaccine. I know you all, I have to turn over to Sunita in a couple of minutes, but thoughts on the vaccine, starting with Dr. Shah and then Dr. Shah.
Sure. So certainly the news from Pfizer is early good news that we're in direction and that there is evidence of with 2 doses of positive news. But the reality is that's just 10 to 20 million doses maximum by the end of the year. And there will be a ramp up after that, but it is going to be some time before we get the kind of widespread availability of multiple vaccines with a secure supply chain that gets everyone the 2 doses they need to actually start to achieve even partial herd immunity, forget full herd immunity. And so if you're thinking about when does life get back to normal, it will require a multiple pronged strategy. In the short term, meaning in the next 6 months to a year, we cannot hang our hat solely on vaccines. It will be everything else in addition to vaccines, protecting essential workers, the vulnerable elderly in nursing homes and others. But the vaccines will ultimately get us out of this, I think, in 2022.
Dr. Shah.
The Pfizer data, I have to say this was a surprise. A 90% efficacy was not what I was expecting. And boy, am I happy to be wrong in that direction on that. So, but it also had a couple of other effects. So while that is true for the Pfizer vaccine, and again, we'll have to see the data and see what it looks like. The second part is that it makes me more optimistic about other vaccines, including Moderna, which is a very similar vaccine construct, but even the other ones that target the spike protein. So I've become more bullish about vaccines in terms of their scientific, in terms of their impact from a science point of view. There are some enormous challenges for the Biden administration in terms of this vaccine. So as Nirav said, first of all, we're gonna have to ramp up production. Production is important. A lot of these vaccines have to be stored frozen and transported frozen. There's a huge logistical supply chain set of challenges there in just getting the vaccines out into the community. You know, the old line of vaccines don't save lives, vaccinations do. There's a huge challenge from a supply chain perspective of getting the vaccines out. And then last, but certainly not least, and maybe even the most important at this point, is that there is a huge challenge around vaccine hesitancy and around engaging people, especially in communities of color, but other places as well, to help people understand why they should get vaccinated. We're not going to have mandatory vaccines by and large, and we're going to have to really engage with people, understand where their distrust comes from, engage with that, engage community and civil leaders and religious leaders. This is going to be a all hands on deck to work with people to get a high level of vaccinations. If we don't do that hard work, by the way, and we just put it out there, 30–40% of Americans will get vaccinated, and that will not be enough to bring the pandemic under control. So a lot of hard work ahead for the Biden team, for states, for public health leaders, for all of us, for journalists, in really clearly communicating to the American people what the benefits and challenges of the vaccine are.
Thank you. I want to turn it over to Sunita for press questions.
Yeah, I wanted to start off with a question myself. How confident are you, Doctors Jha and Shah, that we can get the vaccine out to the communities that most need it? People of color who have been underrepresented in healthcare during this pandemic.
So I'll start by just saying I am confident it can be done if we are deliberate and focused on doing it well. And it meaning, another way to say it is, it won't happen naturally. It won't happen automatically. Communities of color have been really hit hard in this pandemic. There has been, one of the things that I think has been a bright spot has been that the companies doing the trials have been really focused on making sure that they have a diverse set of volunteers. So we're not just testing it in 18 to 30-year-old white men and women, but in fact, we're testing it in a broad swath of America. I think that is happening, and not perfect, but happening. Part of the reason the Moderna trial got delayed was actually to do a better job on diversifying their recruits. If we finish with that, and then we really go out and engage with communities, try to make sure that we prioritize high-risk people who often are people of color, I think we can do this. But what I worry about is a lack of a deliberate effort and just hoping that it'll just naturally happen. And we all know what happens when we don't make a deliberate and proactive effort. It doesn't end up working out well.
Dr. Shah, anything to add?
Just that we have been extremely creative in our vaccine development, for example. That creativity is across the spectrum. There have been creative approaches to exposure notification, to contact tracing, to engaging with communities, to resulting tests of COVID by text messages, for example, from a company named Healthvana. So we can reach people. We know how to do it. We've been thoughtful about it. We just need to do it in a more structured and standardized way, as opposed to the 1,000 points of light approach where every state, every city is doing something on their own. Simple coordination using evidence-based approaches will make a big difference here.
Absolutely. We have a question from Nadia Lopez. Nadia.
Specifically, where do you think the lack of trust in science comes from? Does it trickle down from like the president's comments? Do you think certain communities don't take the threat of COVID seriously enough to take precautionary measures, or many people, especially in California Central Valley, are poor Latino or agricultural workers, and they haven't been protected by local governments or employers. What can a national or state response look like to better protect these people? California was the second state to surpass 1 million infections. And it has been, compared to other states in the country, just been seen to be taking a much better response. So if that's happening in California, what does that say about, the state of things?
Well, I think people, as they understand, as you meet them where they are, they understand the opportunities to protect themselves and their families. It sounds like a hypothetical thing in the Midwest until it hits home, and then people start wearing masks, not just for themselves, but for their neighbors. So having the clear communication, what we haven't had is a simple incident command structure from the federal government, where one voice communicates clearly with the science, with the simple facts, as well as where the places they don't know are. And if you communicate clearly, you can actually make people change behavior in a very short amount of time. You can see what the governors of New York and California were able to achieve in the early months of the pandemic by clearly communicating at regular intervals with all of the data and with storytelling. To the extent that that hasn't happened, that we don't have one voice in charge, that Dr. Fauci may say something that's evidence-based and thoughtful, but then be contradicted by others, that approach is actually very simple. Once we know we have someone in charge of the communication, we can actually move forward very quickly across broad populations, getting people the messages they need in the way they need to hear them so that they can start to behave differently and control this epidemic.
Absolutely. Henrietta Burroughs has a very similar question. Henrietta?
Thanks so much, Sunita. There seems to be a real credibility gap. We hear from the administration that there are so many cases of COVID because there is so much testing. Now, for some, that makes no sense whatsoever. So is there a lack of testing and a lack of tracing? And how much difference would these two things make?
Yeah. So the data on the this is trope that the president has been saying that we have more cases because we test more is just untrue. Testing is actually a really important strategy of keeping the virus under control. And in fact, the state that does the most number of tests per capita is New York, and on a per capita basis, they actually have far fewer cases than everybody else. There's no doubt in my mind that testing and tracing could make a really big difference. Just testing alone can make a very big difference if there is widespread availability of testing and people, after they test positive, self-quarantine. It can make a big difference. But unfortunately, that's the challenge with that right now.
Yeah, we need several things to happen. Testing, sufficient testing across the country is one part of the solution, but it isn't the whole solution. We also need sufficient tracing capacity and ability after we get enough cases down under control. You can't trace every case when there's thousands of cases to trace on any given day. But once you get it down to a manageable number, you can actually trace them and self-quarantine and do all the things we need to do. So what we need is the approach where we do a little here, a little there, a little elsewhere, will all collectively bring the transmission rates down enough. That's the goal. We do not have a silver bullet. Testing alone won't work. Tracing alone won't work. Physical distancing alone won't work. Wearing masks alone won't work. All of these together will collectively bring us to where we need to be and start bringing transmission below 1 so that we actually see cases go down.
Sarah, could you please ask your question? Sarah Nizami.
My question is about travel restrictions. With all of the upcoming holidays, particularly air travel in and out of states, do you think more stringent travel restrictions should be, or guidelines outlined for travelers, aside from the voluntary 14-day quarantine? Expecting people to just do the right thing seems to be hit or miss.
So let me quickly just start off by saying, I think in general, travel restrictions are a bit of a sideshow. I don't think they make much of a difference. Obviously, there is some risk in travel itself, but it's not particularly large. And we don't think that a lot of the virus is, well, I mean, so not a lot of it is spreading from people going from high risk to low risk areas. We do see, obviously, across state borders. So you do see like the large outbreaks in the Dakotas, then spills into Wyoming and Montana. But that's not, most of the travel restrictions aren't going to be able to prevent that. So my general take on travel restrictions is lots of states have them across borders. They probably make marginal differences at this point, especially given how widespread the infection is. And that's not where most of the infection is spreading. And so what I've been saying to governors and health secretaries is, if you feel like you need to put them in for political purposes or you want marginal benefit, it's fine, but don't be distracted that that's somehow a strategy. It's really not. It's a marginal gain at best. And obviously on the international side, it's a much more complicated set of issues depending on which country. If you're an island like New Zealand, you do probably want to put in travel restrictions to make sure you don't get a whole lot of infections from other places. But generally, I don't think it makes a very big difference.
One last question from Julia Dudley.
Yeah, hi, thank you. And thank you for taking all of our questions. My concern has to do with the funding that has gone out. And for instance, in our community, we're seeing a misuse of funds, especially in the African-American community, one of the major concerns, and there's no accountability. So my question is it too late on this accountability? And secondly, what should we be seeing the use of this funds, or what do you recommend the funds should be used? Thank you in advance.
Which funds are you talking? I might have missed it.
I was COVID-19 from the, there's been a number.
The CARES Act?
Yeah, the CARES Act. They've specifically been directed to different counties and communities, especially throughout California. Our county happens to be Fresno County, and we're seeing a lot of misuse and no accountability as far as the use of the funds as well. And we're concerned because we are seeing an uptick, especially in communities of color and even in the Black community. And so you have a monopoly from one organization versus it getting down to the grassroots organizations to help spread the word. especially for people that do not have the internet or broadband.
Yeah, Julie, I don't have a lot to say beyond maybe just 2 or 3 quick points. One is, this is one where money distribution, especially out of the CARES Act, and depends on which of the various things, really should have been, and I think was often left to governors and to health departments to make sure that that got out. What we did see in a lot of places, for instance, was when things like testing sites were set up, they were often set up not in communities of color where the infection rates were really bad, but in places where infection rates were very low. It kind of the opposite of what you'd want to be seeing in those situations. So some of that really has happened, and I think has further harmed the issues of trust in those communities. And I totally not only get it, but I'd be outraged too. I do think it's really incumbent on health departments and on governors and local leaders to make right on that. And while I believe that it will be a new stimulus bill coming from Congress in the next month, obviously none of us know for sure, but if that happens, and hopefully that'll happen, we've got to do a much, much better job getting those resources to the communities that really need it.
Yeah, and part of it is also the lack of guidance on how to spend the money. If New York City school teachers decide that they want to spend all the money on testing, and that's totally inadequate given the price of the tests to even make a difference for the short term, that's based on their best available information. They made that decision, and it won't be enough. Those are the kinds of things where we as a nation haven't come out and said, for example, we need early warning for COVID. No one said that, and no one's funding that. And I believe that an early warning system is an example of something where if we had the funding, if we had the ability to actually focus on that as opposed to downstream issues, we could get ahead of the curve relative to other nations.
Thank you, everybody.